No, it was not. So maybe I'll share the slide set with you once we're done with the lecture. In the interest of time, we're going to continue with where we were. But I expect you to interrupt and tell me if it's not visible for everyone's benefit. So this is another different kind of study where YouTube channels, uploads and views were studied, and the authors conducted statistical analysis of the past 10 years. And here they looked at search string length and the number of videos which come up based on that. And as you can see, the longer the search term, fewer are the videos. And they explored the content, and you can see that the proportion evolution from baseline has been massive. Clearly, YouTube has become very popular over the years, and the various domains, the content related to various domains has grown overall, but not so much in the education sector, more for blogs, gaming, music, and entertainment. So the idea of sharing this is that you frame your research question today. I'm not saying social media platforms are the best means to conduct research, but if you have a unique hypothesis which no one has really looked at, then the initial answers may lie on social media platforms. At most, at least the most it'll do is add some indirect evidence to add weight to your idea, and then maybe you can embark on studies with better methods. So this is another example of a study conducted on a Weibo dataset, which is very popular in China. Most of people are on Weibo in that country, and they looked at Chinese word segmentation. So the methods of this paper are rather complicated, not something we're going to go into detail, but they basically identify 13 different subtopics after analyzing social media data during the early stage of COVID-19 in China. And they found a great correlation with the incident cases of COVID-19 2 weeks later. So when people get talking about COVID, then 2 weeks later, there's a surge in that area, because most of these APIs, they were geosensed and time stamped. So they were linked to the time they were posted and also the exact location where it was posted. And as expected, most of the domains of discussion were fear and worry, questioning the government and media, condemning bad habits, objective comment, taking scientific protective measures, blessing and praying, appealing for aiding patients, and willingness to return to work. So these were then classified into 13 different domains, that is event notification, personal response, and opinion and sentiments. And as you can see from the acquired Weibo APIs, messages related to COVID-19 with pneumonia between Jan 9 and Feb 10. So they obtained this data, and as you can see, they could identify the hotspots, and these hotspots changed with time based on the data set they obtained. So a lot of valuable information out there. There's a lot of fear and worry, questioning the government and condemning bad habits. And these findings call for a rapid situational assessment. It gives us the window of opportunity, particularly to federal agencies, because they can help decision makers to better understand public opinion towards COVID-19. So not just COVID, we are talking a lot about COVID today because these are all recent data and literature, but pandemics and any kind of infections and smaller outbreaks do keep coming up, and these studies never lose relevance. So these can support analysis in planning and executing particularly appropriate resource allocation in the pandemic period, because you get the window of opportunity to help the situation. Besides this, there are also studies conducted on Twitter, we discussed the other day that Twitter may be the platform you may want to be on, and during COVID-19, Twitter was no exception because it was a new disease and people had a lot of questions, particularly how different people will react to Twitter, to the pandemic. So the who and what of diabetes on Twitter is conducted by a general practitioner in the UK, and study the response of people with diabetes. And then monitoring Twitter conversations for targeted recruitment in cancer trials. So it is very important to know if a trial is not recruiting, why people are not enrolling into the study. And looking into Twitter conversations, which are bound to be more honest at times, may provide useful insights. And then why we tweet Emmet, understanding why people use Twitter to discuss mental health problems. So again, it has a therapeutic intent or a change in practice approach can be brought about by knowing why people are discussing. And just for more information, are open data sets, including this Corona V, which is a real-time COVID-19 tweets data analyzer and repository, free for use to everyone. COVID-19 may be gone soon, hopefully, but such data sets do exist, even for influenza or other diseases which keep coming with seasonality. So this is a screenshot of Corona V, and you may go and check it out. So the reason we're going over all this is if you want to publish Sans Real Patient, either you're in a new job for the young faculty here, or if you don't want to collaborate in the immediate environment, or you don't have patients of your favorite disease, or you're in the middle of a pandemic where you can't meet anyone, although that situation is unlikely to arise in the near future again. But going to drift a flow, then there are a lot of studies you can conduct on social media platforms. So WhatsApp is no exception, although WhatsApp data is typically encrypted and even WhatsApp employees don't have access to it. But still there is room for some kind of studies. In fact, as an e-learning method for medical students, and another group conducted a study on the effectiveness of WhatsApp online group discussion for smoking relapse prevention. In fact, it was a protocol which has been published for a planned RCT. So you can even conduct robust studies with the help of social media platforms. And one of these studies, which I particularly could not resist sharing, is wildfire-like effect of a WhatsApp campaign to mobilize a group of predominantly health professionals with a university degree. So the interesting bit was all of these people in the closed WhatsApp group were highly learned professionals, and there was a discussion on the health benefits of 5G. A rumor was floated, and as usually goes, there was no challenge to the rumor, and a lot of people, a petition was circulated, and a lot of people without even understanding what they were exactly doing, a lot of peer pressure out there, they ended up signing the petition. So this says something about social media platforms, and probably flags an issue which maybe like this kind of research may be better useful in improving the app services, but not directly in relevance to the healthcare sector. So to conclude, social media provides a lucrative opportunity to spread and disseminate public health information and information directly to the public, but it can also be a powerful weapon. Not used appropriately can be destructive to public health efforts, especially during a public health crisis. And many of you may have struggled with Facebook and the addiction related to it, but thankfully there are sources of qualitative data sets even on Facebook. So if you have to spend time there, you may like to spend some quality time doing something useful. So there are timeline activity logs. So this is a list of the qualitative data that can be obtained on Facebook. And the key considerations while using social media platforms for research is what kind of user you would want to include in your study. Like if you want to recruit Facebook users, for example, what will be the participant characteristics, which will ensure that the results are generalizable. The degree of activity on Facebook by a study subject will impact the amount of data which is available for analysis. What kind of data will be analyzed, because it's a combination of public and private information, so you definitely can't pick out private information from individual users and start publishing it. So you need to know when to not step the line, and a good study needs to be planned in advance and meticulously, as is always the case. And how will Facebook data be obtained? So you can have access only to the publicly available data, that is the ethical code of conduct on Facebook. And you can also download analytics, provided it is your account, or you see if you're handling a journal account or some other organizational account, or you want to study their analytics to know how well you're doing or how you could push that data out better, then you need to seek permissions. And how to protect data is again something which you need to look at. And there is the core, that is a connected and open research ethics, is a group which is working on defining the data protection policies at the University College of San Diego. And soon these will be out, and these are the code that you need to follow to avoid any copyright infringement. So just a word about core. It comprises not only of doctors, but also technical experts, and they are navigating the ethics and regulatory review process. It also combines other stakeholders to share their expertise and experiences to shape best practices. And we expect these to come up in a bigger way in the near future. Another kind of study which you may possibly conduct online, a qualitative synthesis, if you want to reach out to patients of a particular disease who may be rare to find otherwise, if you are in private practice or you're somewhere where you can't find patients, or you want to reach out to particular patients who may voice their opinion better, then you can do that through social media platforms like Adults on Long-Term Glucocorticoids, qualitative synthesis based on semi-structured interviews. So in this study, the authors wanted to understand the patient views of dietary advice, whether there was a negative image of the diet, what is the psychological impact, and the ways to improve it, and patient views of steroid treatment, which we rheumatologists prescribe often. So feeling of submission to treatment, they felt punished or they felt powerless, and they need more explanations, a better exposure of the balance of benefit and risk for compliance. So, but a word of caution, don't venture out to conduct research by approaching patients, all the patient support groups, because these are not typically for conducting studies, and always have empathy and compassion for the patients. Patient rights should be respected, and it has to be an informed choice. So just a disclaimer out there, but this is something which still remains an option provided it's done in the right way. Another kind of study can be a systematic review of smartphone applications. For example, this is a study which we conducted during the pandemic period, and you would not believe the student I met on WhatsApp on a social media platform, because she is a med student, and I reached out to her to fill up one of the surveys we were conducting on med students, and most of the co-authors in the team, some others, even the second author, saw our Prospero document, the proposal of the study on prospero.com, and he reached out to us that he wanted to collaborate. So there are plenty of online tools, and the online world also gives you a lot of opportunities to collaborate with like-minded people, provided you use it in the right manner. There is a lot of potential over there. And this is a picture of the distribution of apps from India, US, and UK, and what these apps were for. And we identified certain apps which had privacy issues, or apps. The Arogya Setu app, interestingly, was downloaded the highest number of times despite a poor app interface. So so that's all for today, but if you want to read further, then these are two journals which feature a lot of interesting data on technology-based research. And then we also, you can check out this paper on reporting survey-based studies.